So, what's the exact aims or objectives of specialized nutrition support in cancer? Of course, we aim to maintain the body weight and specifically the lean body mass and to try as possible to restore any lost weight. We also need to manage all the aspects caused by the cancer anorexia cachexia syndrome. We also have to identify and manage sarcopenia. We can use tools such as the SARC-F questionnaire that highlights the possibility of sarcopenia. Then we have to assess the severity of the sarcopenia by assessing the body muscle mass and the body muscle composition, and to see whether sarcopenia has reflected in an impairment of the physical function of the patient or not. Each of those stages of management of sarcopenia has its specific tool to assess it. Also, of the objectives of specialized nutrition support in the cancer patients, we aim for to support for better surgical outcomes. So we need to decrease as far as possible any post-operative complication that occurs because of the cancer surgery, and specifically those patients undergoing GIT or head and neck cancer surgeries. If we were able to achieve any of those objectives, we aim to improve the quality of life of the patient, and definitely this will lead to decreasing the overall health costs. In accordance with the European Society for Medical Oncology, the ESMO, in its practice guidelines published in 2021, it states that all patients with a cancer diagnosis having a life expectancy to be at least few months, and by few months they meant 3 to 6 months, any of those patients should have regular nutritional risk screening, and this should be done by a validated screening tools. If patients were known to have malnutrition or at risk for malnutrition, then a comprehensive assessment should be undergone. Comprehensive assessment should be done by a nutritionally trained professional team that includes elements such as the nutritional status, the metabolic status, the performance status of the patient, the functional capacity of the GIT, the occurrence of any nutrition impact symptoms, all treatment modalities that the patient is going to cover, all medication used for cancer or other comorbid conditions, and the physical performance of the patient. And upon collecting all those parameters, we will be able to plan an individualized nutritional tailored intervention for that specific patient that involves all of the following. Starting by food. And by this we mean adjusting the meal's frequency, the meal's texture, the meal's composition, the number of meals provided for the patient per day in accordance to the patient condition, preferences, and also the type of cancer and how does it affect the GIT function or the oral intake of the patient. We aim by all those food modifications to reach 100% of the requirements of the patient from both energy and protein. If we are not able to achieve this through food modifications, we will fortify the food in order to increase its caloric value as well as protein content. By food fortification, we mean adding a spoon of butter, some powdered milk, adding some creamy sauce in order to add value to the food offered to the patient. And for those patients who are still not able to meet their requirements through food and food fortification, we can add an oral nutritional supplement in between the meals offered to the patient. For patients who have a functional gastrointestinal tract, however, they have some sort of an impairment in the swallowing, we can use enteral nutrition. And if patients experienced any GIT discomfort or any other factors that led to the inability to offer all the requirements through the enteral nutrition route, we can add supplemental parenteral nutrition. And at the end, for those patients who are having non-functional gastrointestinal tract, the last way to offer their requirements through specialized nutrition support is through total parenteral nutrition. So we can see that the nutritional plan of the patient is highly individualized. It goes in a stepwise fashion, aiming to use the normal physiological pattern of using the GIT and ending by using the parenteral route. Of course, at any time, if the possibility to use the GIT is restored, we have to go back through GIT feeding. What are oral nutritional supplements that we mentioned previously several times? ONS or oral nutritional supplements are products that are used for oral nutrition support. They provide additional nutrients or additional nutritional value, including both protein and energy. They are usually used in patients who are not able to meet their daily nutrition requirements through food alone. And of course, those patients can have GIT feeding normally. So they are usually added to the normal diet. Oral nutrition supplements are considered to be dietary foods for specific medical purposes. They can be used in specific patient populations and in different medical conditions as well. However, we have to highlight that ONS could either be nutritionally complete, which means that they can be used as the sole source of food. Also, they can be nutritionally incomplete, which means that they do not contain all nutrients in quantities sufficient to meet the daily requirements of the patient. In order to be able to meet different clinical conditions and different disease states of patients, oral nutrition supplements can be enriched with specific nutrients in high concentration, for example, nutrients, which we are going to talk about later on, and they are only approved for supplementary nutrition in that case. So, generally, the recommendation or the indication for oral nutrition supplement could either be for having a positive impact on the outcome of a disease state, for example, the cancer diagnosis, patients with inflammatory bowel disease, patients who suffer from immunosuppression, or in order to replace or supplement regular food, or in order to treat malnutrition in general. So let's take a quick look into the guidelines. And here we are talking about the ISPIN Practical Guidelines, Clinical Nutrition in Cancer, that was published in 2021. And let's see how they recommend the use of oral nutrition supplement. Recommendation B31 recommends the use of oral nutritional supplement in cancer patients who are able to eat, but they are considered to be malnourished or having a risk for malnutrition, in addition to dietary advice, the treatment of symptoms, and the arrangements of impaired food intake. It also recommends the use of oral nutritional supplements in patients who are being treated with radiotherapy, specifically radiotherapy to the head and neck, thorax, and gastrointestinal tract, emphasizing that in those patients an adequate nutritional intake is usually not easily achieved, and it's very important to maintain that adequate nutritional intake during radiotherapy, specifically in those populations. That's in order to avoid nutritional deterioration, maintaining the intake, and avoiding any radiotherapy session interruptions. Still looking at the guidelines and the ISPIN Practical Guidelines Clinical Nutrition in Cancer, we need to know what about the energy requirements and the protein requirements of the cancer patient. Actually, the total energy expenditure of cancer patients does not vary much from the normal healthy subjects. It's usually ranging between 25 and 30 kilocalories per kg per day for non-obese patients. And in terms of the protein requirements, we desire for a protein intake of 1.5 gram per kg per day for non-obese patients and at least 1 gram per kg per day. So now let's look at some evidence about the use of oral nutritional supplementation in the cancer population. In a systematic review and meta-analysis that was published in September 2025, they highlighted that high-protein oral nutritional supplement, and by this they mean ONS that provide around 530 kilocalories and 34 gram protein. They emphasized that the use of such high protein oral nutritional supplements in cancer patients reduces complications and the length of hospital stay. The systematic review and the meta analysis provide evidence that the use of those high protein oral nutrition supplements, including the ONS that contain or are enriched with high content of omega 3 fatty acid, alongside the dietary intake, is associated with a significant reduction in the complications and the length of stay in cancer patients. It's now a well known fact that the use of an ONS in the surgical GIT cancer patient is associated with many positive outcomes. However, the evidence of the use of those ONS in the perioperative care of oral cancer as a type of head and neck cancer was not well established. So let's take a look on that systematic review and meta-analysis published in May 2025 that was addressing the beneficial outcomes of what is known as immune-enhancing nutritional interventions in the perioperative care, and by this we mean preoperative and postoperative care for oral cancer patients. By immunonutrition, we mean the use of the nutritional agents which have been shown to support the immune response and reduce inflammation and thus improving the wound healing. The most commonly studied immune enhancing agents are arginine, glutamine, nucleotides, and omega 3 fatty acids. The systematic review went through 8 different studies conducted on oral cancer patients. All of those studies the intervention, and by this we mean offering oral nutrition supplementation, was done post-operatively, with the exception of only one study in which the ONS was offered perioperative, so pre and post-operative. The key outcomes reported were related to healing, decreasing healing failure, decreasing the surgical site infection, the occurrence of adverse events in the population receiving the ONS, the impact of the length of hospital stay, and the nutritional status of the patient. The results from that systematic review and meta-analysis suggest that administering immunonutrients, specifically arginine, omega-3 fatty acids, and nucleotides, significantly affects the surgical outcomes, reducing the incidence of complication. And by the surgical outcomes, they meant the suture and healing failure, the surgical site infection, facilitating faster recovery, and shortening the length of hospital stay. However, they commented that although there is a statistically significant reduction in the length of the hospital stay, however, because of the relatively wide confidence in interval, there is a suggestion of variability across the studies, and this limits the precision of the finding or the impact of ONS on decreasing the length of hospital stay. Which means that while immunonutrition may reduce the hospital stay, but the exact magnitude of benefit remains quite uncertain and should be interpreted with caution. The findings from that systematic review are consistent with the evidence supporting the use of immunonutrition in various surgical contexts, particularly in surgical GIT, in cancer patients, of course. They concluded that the result of this systematic and meta-analysis provide compelling evidence of the potential benefits of immunonutrition in the perioperative management of patients with oral cancer. It's crucial to refine protocols, elucidate the underlying mechanism, and optimize the delivery of immunonutrition in the context of oral cancer surgery. And by fostering an interdisciplinary collaboration involving different disciplines and different specialties caring for the cancer patient, promoting patient-centered care, and leveraging lessons learned from other surgical specialties, we can unlock the full potential of immunonutrition and revolutionize the perioperative management of oral cancer, ultimately improving the lives of patients. So now, where do pharmacists stand from all of this? For cancer patients going through the treatment journey, which is a very long, complicated journey, it's not a one time medical moment, but a demanding and an everyday journey. So, definitely, pharmacists will have a positive impact and quite an important role throughout this journey. Pharmacists play a critical role in ensuring treatment success of the patient journey in terms of securing the acceptance and delivery of the prescribed of other medical nutrition needs, supporting patients in integrating medical nutrition into their daily life, reinforcing of correct usage, frequency, and duration of adult medical nutrition. From what we have been talking about, we can also figure that the pharmacist's role in the management of specialized nutrition needs of the cancer patient is not only focused in the hospital setting, it could also be in the community or in the ambulatory setting. So, if we looked at the metabolic nutrition pathway, which starts with the nutritional screening and rescreening, going into the comprehensive nutritional assessment, which include looking at the anthropometry, biochemical data, the clinical examination of the patient, the dietary recall or dietary condition of the patient, and even the exercise condition of the patient. All those comprehensive nutrition assessment parameters will lead to the development of the PES statement of the patient, identifying the nutritional problem, knowing the causing etiology of the problem, and highlighting or identifying the associated symptoms of malnutrition. And here comes the role of offering oral nutritional supplementation to the patient and encouraging the physical activity, of course, under medical supervision. Some patients will need further specialized nutrition therapy in terms, as mentioned earlier of enteral nutrition, supplemental parenteral nutrition, or total parenteral nutrition. And of course, a successful metabolic nutritional pathway has to go through different monitoring parameters and continuous follow-up. In all of those phases of the metabolic nutrition pathway, pharmacists can contribute towards the success of the nutritional care plan of the patient. So, during the patient journey, pharmacists can help in the nutritional risk screening, can aid in health promotion, and counseling the patient on the importance of adherence to the nutritional plan and following healthy eating patterns and adherence to the recommended exercise level, communicating with the patient in order to build the patient trust, continuous nutritional counseling and education, emphasizing the importance of nutrition in the cancer patient, in which we identify nutrition in the cancer journey as the parallel pathway to the oncological pathway. So we have to emphasize to the patient that monitoring the nutritional status is as important as monitoring the response to the oncological treatment. We also have to address why do we identify the nutritional impact symptoms. Pharmacists also can offer pharmacological recommendations to manage those nutritional impact symptoms. Also, any pharmacological recommendations to manage any associated treatment toxicity, specifically nausea, vomiting, anorexia, constipation, xerostomia, mucositis, diarrhea, dysphagia, and any other nutrition impact symptom that may affect the nutritional intake or uptake by the patient. In terms of the pharmacist's role in recommending oral nutritional supplementation, pharmacists have to guard against the product availability, the product variability, because ONS come in different, not only forms, ready, easy to use, forms such as custard, sip feedings, protein bars, but also they are variable in terms of their caloric density, in terms of their protein content, in terms of being enhanced with specific nutrients such as immunonutrients. So, pharmacist aids in the availability of different or variable ONS. Pharmacists also help in the selection of a specific ONS in according with the clinical condition of the patient, the dietary intake, and the patient preferences. We also, as pharmacists, educate the patient on how to use the ONS, if it needs specific preparation, how to administer, and issues pertaining to stability and safety. We also monitor the patient acceptance and adherence because it's very important that the ONS is palatable for the patient and the patient is able to take it as recommended by the healthcare provider. So, patient acceptance and adherence in terms of taste, GIT symptoms, affordability for the patient, which is a very important factor, availability, psychological issues, the presence of a caregiver who can help the patient in taking the ONS, and of course, educating the caregiver as well as the patient. So, specifically, when we address the management of different nutrition impact symptoms, that could be either abdominal pain, dysphagia, constipation, vomiting, malabsorption, diarrhea, we mentioned earlier that the pharmacist has a great role in the pharmacological recommendation of the drugs or the medication that could target the management of those nutrition impact symptoms. So, before we start tailoring the dietary intake of the patient or shifting from food into GIT enteral feeding, we have to address the management, and by this we mean all possible management, including pharmacological management of the nutritional impact symptoms. And of course, pharmacists have a very important role in those patients who only can receive their nutritional requirements through parenteral nutrition. Pharmacists help in the preparation, the admixing, the compounding, the order writing, issues related to the nutrient drug incompatibilities, and in safety and stability issues. So, to summarize what we have been talking about today, weight loss affects 15 to 80% of cancer patients, dependent on the stage of the cancer, with up to 20% of those patients may die from malnutrition rather than from dying from the cancer itself. Malnutrition negatively affects treatment adherence, increases the severity of side effects, decreases the quality of life. Nutritional goals aim to maintain the body weight and lean body mass while managing cancer, anorexia, cachexia syndrome, and sarcopenia. The guidelines recommend energy intake of 25 to 30 kilocal per kg per day and a protein intake ranging from 1 to 1.5 gram per kg per day for non-obese patients. High protein oral nutritional supplementation and immunonutrition reduce the surgical complications and shorten the hospital stays. The pharmacist role includes screening for nutritional risk, counseling on nutrition impact symptoms, ensuring oral nutrition supplement product availability, and patient adherence. In conclusion, malnutrition is a key modifiable risk factor in oncology, influencing medication efficacy, toxicity profiles, and overall treatment tolerance. Pharmacists play a critical role in identifying patients at nutrition risk, especially those experiencing weight loss or reduced intake that may impact dosing strategies, pharmacokinetics, or treatment adherence. Early nutrition support, including the use of oral nutrition supplements or even specialized medical nutrition when appropriate, helps stabilize body weight, preserve lean body mass, and improve resilience during chemotherapy, radiotherapy, or combination treatments. Close monitoring is essential as nutritional decline can progress quickly during active cancer therapy, requiring timely adjustments to the nutritional strategies and supportive medications. Those are the references mentioned in this presentation today. I hope that it has been useful for you and it will help you in providing the adequate care for your cancer patients. Thank you very much.